How's it going? My name is Jeff and I'm a licensed occupational therapist practicing in America, and I go by the name OTDUDE. So today I'm going to be going over how to get a patient, for you, the caregiver, out of bed. And if you haven't already, I highly recommend that you check out the video on how to prepare to get a patient out of bed before you actually get a patient out of bed. In that video, which I'll post in the top right-hand corner, I go over how to manage things like oxygen lines, urine bags, and just general safety things so that you are comfortable moving someone before you actually move them. So after watching that video, the first thing to do when getting out of bed is to basically have the person, if possible, move as close as they can to the edge of the bed, because this makes your life easier. It's easier to work with someone who's closer to you than farther away because you're limited by this bed. Unless you actually get onto the bed, ultimately it's easier to have them closer to you by the edge of the bed because you're gonna have to help them stand up and sit up from the edge at one point or another. So I think hopefully that makes sense. I have here my friend Mr. who's going to stand in for a real patient today and basically have the patient do as much as they can. I know as a caregiver it's easy and you want to help people out, so you get into the kind of over-helping kind of mode. So it's best, in also for the patient too, to help them build strength, have them be empowered, have them feel like they can actually do the task itself of getting out of bed. Your job really is to kind of stand by and help when needed. Now, of course, Mr. here is not actually going to be able to do any work because Mr. is not a real person, so I'll be doing like all of the heavy lifting. But in real life, your situation as a caregiver may be different. You may have a patient who is able to help a little bit, sort of a lot more than that, help a lot, or completely be independent and be able to get out of bed and just need you for just in case, for kind of like a safety net. Before we get out of bed, let's have you move closer to the edge so that it's easier to work with you, and so that it makes it easier on my back too. So what I'm doing is I'm going to move the covers out of the way, and just like how I talked about in the first video, I'm checking for things like lines and things that may get in the way. I went over checking going from the head to toe. What you can also do is kind of like a clock and go, say, from 12 o'clock to 3 to 6, and each part of the body represents part of the clock. So for example here, this is the 12 o'clock, this is the 3 o'clock, this is the 6 o'clock, this hand right here is the 9 o'clock, all the way back to 12 again. So I'm going and checking all the way, basically. I'll show with my hands where I'm looking. Pretty self-explanatory how a clock works if you're used to looking at an analog clock. These days, I guess not many kids are using analog clocks and you're used to the digital. So that's how I look for things. Okay, now Mr., let's have you move closer to the edge of the bed. And one way that you can have the patient do that, and I know each patient has different kind of limitations and strengths. So just in very general, what they can do is bridging. Now, there isn't one like straightforward, like real, like technically clean way to do it. It kind of just takes some practice and more kind of like, just basically more practice. So what happens when the patient bridges is they bend their knees, and if they can't bend their knees, you can help the patient to bend their knees for them. And let's assume that the patient cannot go any closer to their bottom than this. By the way, it does help to have them bend as much as possible, but if there's pain, of course, don't go into any bending that causes anybody more pain than that. So let's assume that patient can bend this much. So what they do is basically bridging. They can use their torso and all their muscles to kind of bring their bottom up and their lower torso up and forming a bridge. And when they do this, they simultaneously try and scoot the middle portion of their body towards me, the caregiver. So if you imagine dividing the body into 3 segments, 1 the upper body, 1 the middle, and 3 the lower legs, what they do when they bridge is they kind of bring the middle of their body closer to me. You see, this looks a little exaggerated, but this is kind of what it looks like. And this is helpful because the middle portion of the body isn't really able to move. We don't have like anything to pull with. Like our legs are able to move and our arms are able to help us move, but the middle portion, we don't have any like limbs, so to speak. So what bridging allows the patient to do is basically bring the middle portion of their body closer to me. And then from there, they can use their legs and their arms to pull the lower part of their body and then their upper part of their body, respectively, towards me. So from here, it's pretty self-explanatory. The patient can just using their own strength to bring their legs towards me, or I can help them do that. If I were going to help them do that, it's pretty much go slow, bring it towards me. And then from here, they have the upper portion of their body basically that's left behind, so to speak. So they can kind of use their arm, like their right arm, to kind of pull the edge of the bed towards me. So it kind of looks like this. They would bring their arm kind of towards the edge of the bed here, and they would just pull. And then basically from here, the patient is basically closer to me, but their body is more or less straight now, kind of like in the same like alignment that the patient started with when they were in the middle of the bed. Now, it's definitely okay to do this in multiple kind of moves. The patient and you don't have to both do everything in one move. Like nobody says you have to do it all at once. You can just take your time and do as many moves as it takes, and basically based on how much the patient can do to the best of their ability, right? You want to have the patient do as much as they can, and you definitely don't want to overhelp because you don't want to tire yourself out as the caregiver too. So from here, the patient would do the same thing. Start with the bridge, bring their middle torso closer to me, and then do the lower legs next, or they could do the upper body, doesn't really matter. I prefer to do the legs first, just because, I don't know, it just seems more natural to me, and then they can bring their upper body towards me, like their torso. Or the patient can do it simultaneously. This is just breaking it down into like real concrete steps. But in real life, patient can kind of just do those things kind of all together, like the lower body and the upper body. Now, they technically don't need to unbend their knees. They can leave their knees bent. I just kind of have it like this just to show you, like, again, the process. So let's make sure they're not all weird. And okay, mister, let's have you bridge towards me. Let's pretend that the patient does it by themselves. So they're gonna just bridge, bring their torso towards me. Okay, good. And then they're gonna bring their legs closer to the edge, closest to the edge as they can. And then with their arm, they're like, it's really easy now since their arm can really reach the side of the bed, and then kind of pull towards me. Here we go. And from here, you don't really have to do it again. They're pretty much more or less close to the edge, because the next thing you want them to do is to roll and roll towards you. So if they have the strength, you want them to use their left arm if it's this direction. If it's mirrored and you're doing it in the opposite direction for the opposite side of the bed, then you would use the right arm. And it helps to actually have the patient's knee bent too, because it's easier to kind of pivot. To help the patient turn, I have one arm under the shoulder and one arm under the hip. And one question that I often get is, what does the patient do with the arm that's like underneath them? The most important thing is to make sure it doesn't get left behind. So it's not behind them, it's not in a weird position. It's basically as close to the edge of the bed as possible, and it's accounted for. Swing their legs off the edge of the bed, like so. Here I help the patient swing their lower legs over the edge of the bed. You want the patient to basically do as much as possible. So what they can do is they use both their arms to push away from the bed, basically push up from the bed into a sitting position. Now they can use both arms to do this. The arm that's under can kind of push out upwards, and the arm that's over, the overhand, can kind of push away as well towards basically the ceiling. So what you do as the helper is you tuck your arm, one arm kind of over here, basically by the shoulder, a little bit under the shoulder joint, and then the other arm can be at their knee joints. If the patient has limitations in their knee, or they're not comfortable with that, or they have pain there, or they're missing a leg or two, then you can use the hip as a second kind of position alternative. So I'm gonna do one position, the first preferred position here. So I'm gonna have one hand under the shoulder, basically, and then the other arm where their knee is, where I can reach. Of course, if their knee is like if they're really tall and I can't reach their knee, I'm just gonna have it as close as I can as possible. And I'm gonna wanna be as close as I can to the patient. So I'm not working like this, like I have a huge gap here. I'm gonna be as close as I can. So don't be afraid to get close, and this works to your advantage. If you have a bed, by the way, that can go up and down like a hospital bed, tip is to basically bring it higher, because the lower the bed is relative to you, especially if you're tall, the more work you're gonna have to do because you're tall and the bed is low. But if you bring the bed closer to you and the patient closer to you, as high as you are comfortable to do it, then the easier it is for you, the caregiver, as well, by the way. Now, you don't wanna have the patient's bed way too high, like way high, because they're kind of have to have a harder time getting onto the ground too. So there's kind of like the pros and cons of that. So from here, basically you're gonna work with the patient and simultaneously work together on the count of 3 while the patient pushes up, you kind of help give them a lift. And remember, as mentioned in the video, you don't wanna do more work than you need to, so have the patient do as much as they can. Simultaneously, when you guys count to 3, you're gonna have the patient push up from the bed with both of their arms, and then you're gonna lift up basically with the under the shoulder hand, and then with your other hand for their legs, you're kind of trying to push and kind of pivot them at the same time, kind of like that. Okay, on 3 now. 1, 2, 3. Okay, on 3 now. 1, 2, 3. And one tip when you do this is to have your knee or your leg touching their knee so that they can't slip out from under you. Or if they have really poor balance, or they kind of like slide, I guess, so to speak, you can have your legs there so that it prevents them from kind of getting out from under you and sliding off, basically. Here's a replay of all the steps once the patient is at the edge of the bed. Notice the hand placement to help them roll. Once they are rolling, they can bring their legs over, or I can help them as a caregiver. And then working together, we're gonna sit up in 3. And here it is again, one more time for you guys. And try to move with the patient in tandem so that you don't exert more energy than you need to, and to take your time. And that's about it. It's pretty straightforward from here. The more practice, the easier it gets. Thanks for watching, and good luck with this.